હાર્ટ એટેકને પ્રિવેન્ટ કરવા માટે સુગરવાળી વસ્તુ, મેદાવાળી વસ્તુઓ, બેકરી પ્રોડક્ટ્સ, તળેલી ફ્રાઈડ વસ્તુઓ, પ્રોસેસ ફૂડ કે જેમાં ટ્રાન્સ ફેટી એસિડ રીચ મટીરિયલ વધારે હોય છે, જે ઇન્ફ્લેમેશન લાવે હૃદયની નળીઓમાં, તે બંધ કરવાનું હોય છે. કોલ્ડ ડ્રિંક્સ તેમજ દૂધની સેચ્યુરેટેડ દૂધની બનાવટો જેમ કે સ્વીટ્સ, આઈસ્ક્રીમ, લસ્સી, આ બધું બંધ કરવાનું હોય છે. આલ્કોહોલ, સ્મોકિંગ વગેરે બંધ કરવાનું હોય છે અને સિમ્પલ નેચરલ ડાયટ ખાવાનું હોય છે, ફૂલ રો ફોર્મમાં, અને કુક ફૂડ, ઘરનું ફૂડ ખાવાનું. તમે હોટલ છોડી દો જવાનું તો પણ તમારે હાર્ટ એટેકનું રિસ્ક તમારું એકદમ ઓછું થઈ જાય. કારણ કે હોટલમાં ફૂડ જે બને છે રિપીટેડ ઓઇલમાં હીટ થતું હોય, એટલે ટ્રાન્સ ફેટી એસિડ રીચ હોય અને પામ ઓઇલમાં બને. એટલે આઈ ડોન્ટ થિંક કે હોટલનું ફૂડ હ્યુમન હેલ્થ માટે સારું છે. એટલે અવોઇડ હોટલ ફૂડ અને અવોઇડ ધીસ fried food eat available on outside. And one thing is clear that there are many treatments to treat heart disease, but in 70s there was no science developed, so bypass surgery was the treatment to revascularize localized portion of the myocardium, means heart muscle. But it is a very lengthy process, and due to heart lung machine and ventilator, heart become weak and arrhythmic. So chances of complications are high, particularly in diabetic and kidney patients, and heart become weak after surgery. You find something relief of chest pain, temporarily palliative treatment. And American Heart Association and all European Cardiology Society says that stent after 12 hours is not useful. After acute heart attack, after 12 hours, not useful. So the hospitals are running on cardiology department. Maximum their income from cardiology, orthopedic, neurological department, and all the segments of the GI tract, and they are running on. Every department has own strategy and own parameters given to doctors that this much patient should be stented or bypass, because the doctors are on high salary, so they are in constant thinking to develop blockages, and there is no IVAS, no FFR, nothing, but they are showing blockages and place stents, and if triple vessel or long segment listens in, they advise for bypass surgery. But I think people are so prone to go for stenting or bypass is common, in spite of their suffering after that. People know that there is a one new treatment FDA approved. In investigation, it was FDA approved all over the world, including America, Europe, India, Saudi, Russia, Turkey, all over the world. But they know that this is better, along with intensive medical treatment as per ischemia trial. But people prefer to follow cardiologists or cardiac surgeons' advice in hospital, because there is a big marketing team to threaten and means to wash the mind of the patient. They create big scare of blockages, but there is nothing like that. You have to check your blood, inflammatory marker, lipid profile, uric acid, some vitamins, B12, D3, if you are diabetic, 3-month diabetes, HbA1c, fasting blood sugar, if you have kidney disease, creatinine, blood urea, serum lactate level. This should be checked, and you can judge according to that intensity of heart disease. The main test for heart disease is blood and echo, and then thallium sestamibi heart scan and CT coronary angiography. So no doctor can force you to go for stenting or bypass in that test, because mostly stenting and bypass occurs by forcefully endeavors that if you have not done, anything can happen, or at any time blockage can blast and you can die. This type of threatening given in hospitals. So patients are forced to give. And second thing, Ayushman Yojana. The most benefit of Ayushman Yojana is getting from to hospitals, private sector or government hospitals, semi-government hospitals. They are getting maximum benefit, and patient has nothing to pay, so they prefer to go down for this type of process, and after that they suffer. So my intention is that the newly investigated treatment, EECP, enhanced external cardiac counterpulsation treatment, that we are masters in that. We have done training at Dubai, US, and we treat thousands of patients to avoid bypass surgery. We treat patients who have been advised heart transplant, 10% pumping patients. We have treated severe right ventricular failure, left ventricular failure patients, DCM patients, dilated cardiomyopathy patients, diabetic kidney patients. So we treat heart disease to avoid bypass surgery and to treat heart failure, to make heart stronger and develop natural bypass. And there is a protocols of different strategy. But after the EECP, you get rejuvenated. Like bypass and stenting, you have no fear of that. Again, there may be blockage in stent or bypass segment. So you are mentally free. You have to take medicines as per guidelines we give. You have to maintain diet. And one thing is clear, that in angiography, small blockage, 20%, 30%, 40%, that is oil droplets like blockage, that is not seen in angiography, are more vulnerable for the heart attack. They rupture by diabetic or hypertension, stress, overexertion, they rupture and create heart attack. Big blockage are covered by smooth muscle cells, collagens, so they rarely rupture. If you control your diabetes, if you control your high BP, take intensive medical treatment, and you develop natural bypass, by enhanced external cardiac counterpulsation EECP. From our experience hand, your pumping will increase. If your pumping is less, then if your pumping is good, then you can also take EECP, because by vascular growth factor, hepatocyte rich growth factor, platelet derived rich growth factor, and stem cell, there is a development of new vessels surrounding the blocked arteries. So new network develop and dormant vessels open in the myocardium that has been blocked from adolescent to adult life. And the beauty of EECP is that it reduces the volume overload and reduce the cardiac hypertrophy and reduce the afterload of the heart. So one side it's increased blood supply to the heart, and on second side it reduces the resistance of the heart. So heart become rejuvenated and increase pumping and intrinsic myocardial contractility increase, diabetic substantially down, and your drugs or insulin maybe stop, and mostly it is going to be stopped or reduced. And renal artery blood flow increase, so creatinine level can be expected to downfall after the EECP treatment. If you are on a intensive medical treatment of kidney disease but not on a dialysis, because in dialysis there is a arteriovenous fistula develops, so we are not giving EECP the patients on dialysis. But if you have high creatinine level and not on dialysis, then EECP along with medical treatment for kidney disease, heart disease, you will get excellent result without any surgical intervention or any needle or any stent. And the second beauty is that after bypass surgery or stenting, if you have again chest pain, that stent has been reoccluded or restenosis, or graft of bypass surgery has been reoccluded or restenosis, so again redo bypass or redo angioplasty can be done, but it is very risky. So in EECP, you can done after 5 to 7 years. You can repeat the some sessions of the EECP to rejuvenate again your heart by opening the vessels. So this is the beauty of EECP, that it is a master treatment for heart failure. Thank you very much.